Hi, I'm Kelly Craig, and we've teamed up with Cleveland Clinic, Florida, with tips on keeping you healthy. Actually, it's some interviews that could help save your life. And today we're talking about lung cancer, and joining me is oncologist, in fact, he's the chairman of the department, is Dr. Rogerio LILENBAUM. Welcome.
Thank you.
So tell me about the very latest diagnostic techniques.
So I think it's important that for a long time, lung cancer did not have a screening technique. So like we have mammograms for breast cancer or colonoscopies for colon cancer, we were unable to diagnose people early on with lung cancer. And this changed since last year, and I think it's important for everybody to know. So if you happen to be at risk for lung cancer, if you have a certain age and you've smoked a certain amount of cigarettes throughout your life, there's now evidence that if you obtain a CT scan of the chest with very low dose radiation, so it doesn't actually expose you to a high dose radiation such as other diagnostic tests, you can detect early stage lung cancer that is highly curable. Oh. This is a dramatic difference from the way lung cancer is usually diagnosed in practice. Because by the time we diagnose lung cancer, most of these patients unfortunately will have advanced disease and cannot be cured. The CT screening technique, which we now have at the Cleveland Clinic here in Florida, allows us to identify individuals before they develop symptoms. And therefore, they can have that tumor resected and be cured at a much higher rate than if you wait until symptoms develop.
But how does one come to you before symptoms start to show?
So if you're over the age of 50 and you smoked at least a pack of cigarettes for 20 years, or you could have smoked 2 packs for 10 or half a pack for 40, it doesn't matter. If you have a significant exposure to smoking and you're above the age of 50 and you have no symptoms, by the way, you don't have to have symptoms to undergo screening, that alone qualifies for a screening CT scan of the chest based on the study that was published in the New England Journal of Medicine last year. And this was a study of over 50,000 people, which demonstrated a 20% reduction in mortality by using CAT scans versus chest x-rays.
That's very encouraging.
It is.
For those who are diagnosed with lung cancer, tell me about some of the ways you treat the disease.
So if the disease is still localized to the lung and there's no evidence that it has spread to lymph nodes or outside the chest, then we typically refer that patient to our surgeon. Here at the Cleveland Clinic, we tend to do minimally invasive surgeries. So it's very small cut, very fast surgery. Sometimes it's done with the use of a robot. It's the robotic procedure. Sometimes it's done without the robot. But the advantage of that procedure is that people can be out of the hospital in 3 days after chest surgery. So this is a huge difference and a dramatic improvement again from what we used to see 10 or 15 years ago when people had to spend over a week in the hospital to recover from chest surgery.
For more information about lung cancer and screenings, log on to clevelandclinicflorida.org. There you will find articles and local Cleveland Clinic Florida resources that can help. And don't forget to join us every Monday at 11 for more tips on staying healthy with Cleveland Clinic Florida. I'm Kelly Craig.